Yes, I just said, I've got it. Yes, I just said to people, I've got a terrible cold, so forgive me if I have to keep stopping to drink a little bit of water, or if I cough halfway through. But yeah, it's really great to be here today. So I'm going to talk to you, as you said, about our use of expert elicitation in the Global Burden of Animal Diseases program. I think I want to just stress at this point that this is still very much a work in progress. So we're quite a new program as these things go, and we're still developing and exploring our methodologies. And so that's one of the reasons I really wanted to talk to you today, was to get some input from experts in the field. So any feedback and discussion at the end would be really great for you. There we go. So today's talk, I'm going to talk to you a little bit about what the project is, about our analytical structure and the data requirements that we have, and specifically the animal health loss envelope, which is one of the method that we use to calculate the burdens we're interested in. I'm then going to talk to you about our use of expert elicitation, specifically in Ethiopia and then more recently in Senegal, and some of the challenges that we face and the possible solutions that we're considering. So what is the global burden of animal disease, or GBADS? That's what we call it. So it's a global research program, and we're aimed at measuring and understanding the global burden of animal diseases. It's similar in concept to the global burden of disease, the GBD, which some of you may well be familiar with. And it's co-led by the University of Liverpool and the World Organization for Animal Health, or WOA. And we use an innovative framework to estimate the social and economic burden of animal diseases, specifically in livestock. And with this aim, with this framework, we aim to provide data and information that supports sustainable animal health across the world. We need this improved data on burdens to lead to improved investments, improve resource allocation in animal health, and improve a way to improve the evaluation of animal health impacts and intervention. Although animal health and livestock is a huge sector, huge industry worldwide, and is incredibly important for sustainable livelihoods, data in this area can be very sporadically collected and can be difficult to access. So we're trying to do our bit to overcome some of those challenges. So our analytical structure, this is kind of broad overview. So we start with our livestock population, and we're thinking about their biomass, so their overall weight, and the kind of inputs that go into those systems in terms of cost. And then we also are estimating the value of those animals and the value of their output, so meat, milk, etc. We then move from this population level approach to think about what we call the animal health loss envelope, which I'll talk to you in a bit more detail about in a moment. But in this, we're thinking about what we're losing and what we're spending, and the difference between the current scenarios of current production and what we might see in an ideal disease-free setting. When we have this envelope, then we're also interested in attributing this. So this is the sort of scale of disease burden. We obviously want to attribute it to specific diseases, specific health problems, and to understand which of these things are causing major burdens. All these things happen at the farm level, but we're also interested in what happens at a society-wide level. So we're also looking at societal and economy-wide impacts of animal disease. So in order to calculate these things, in order to calculate the burden, we need data, a lot of data, as you can imagine. So this here is just an overview of the amount of parameters, the number of parameters that we have in order to calculate disease burden. So there's a lot of things. So we're thinking about population parameters, growth, mortality, the inputs that are going into those systems, so things like feed and other fixed costs. And then obviously all the things that come out, so milk, eggs, meat, etc. But also the use of draft power for animals and the live animal price. And then all this data goes into a dynamic population model, which allows us to produce gross margin. And so we can look at the value of these systems as a whole. So this is where the animal health loss envelope comes into play. And this is also where we start thinking about expert elicitation. This is one of GBAD's main outputs. Sorry, pardon me. But not outputs. This is one of GBAD's innovative framework. So the development of the animal health loss envelope. So we can think of this animal health loss envelope as a kind of container or an envelope in which all the production losses due to suboptimal animal health are contained. It's a theoretical boundary, but it's important to our methodological framework. So in its simplest form, we can think of it as the difference between production in current health, so what's happening in the real world, and the production that we would hypothetically get if disease was removed from that system. So in an ideal, what we call an ideal health performance scenario. And the difference between those two is the animal health loss envelope. This explanation is deceptively simple in many ways. Defining health in humans or animals is very challenging. And this is highlighted by one of the key elements of the animal health loss envelope, which is that this difference should represent the change between current and disease-free in the environment that animal that we're thinking about that animal in. So, for example, if we're looking at dairy production in an extensive pastoral system in Ethiopia, we want to make sure that we're comparing an animal in the current an animal's current health in that system to the same animal but just without disease, but not that we're comparing a cow in that system to a high producing Frisian dairy cow in an intensive UK system. So the environmental, genetic and broad nutritional factors should remain the same. So when we're thinking about how we calculate this, obviously we need the current scenario and we need an ideal scenario. For the current scenario, this is data driven. So this is I won't go through this, but this we have a very clear kind of hierarchy of evidence approach to producing these estimates for parameterization for the current scenario. Moving through, starting with primary data, systematic reviews, meta-analysis, and so on, as needed. And sometimes we may use expert elicitation in that process if we find that there is no data to parameterize a certain value. However, that kind of structure, that framework is reasonably straightforward. What's more difficult and more challenging is how we estimate this ideal hypothetical disease-free scenario. So we thought about various different methods, so thinking about regression analyses, benchmarking approaches, looking at the top producers, exploring kind of mechanistic maximal production models. But the approach that we've been using so far and that I'm going to also talk about today is using expert elicitation. And we feel that this ideal parameter is suitable for elicitation in that it's knowable in theory, but it's not currently measurable. So our first attempt at estimating this ideal production state was undertaken during our Ethiopia case study. So this started in 2021 and is ongoing. We're still working very closely with teams in Ethiopia. It's really a proof of concept for GBADs, and it's what we've been working on in depth over the last 2 years. It's given us an opportunity to implement, define, develop and refine our methods, and then also getting feedback on our methods and our outputs from local stakeholders and end users. We used 2 elicitation approaches during this case study. One was for the ideal parameters, which is what I'm going to focus on, and the other was for the attribution of those parameters within the animal health loss envelope, and we used an idea approach for that. I'm not going to talk about that today, but there is there's a paper that I can refer you to if people are interested. So the methods for our case study. So we used a Cook's method elicitation. It was carried out in an in-person workshop in Ethiopia in 2022. Experts were identified through publications, known research interests within the country, and then a kind of snowballing process of identifying other experts through those means. We ended up with 10 participants, 10 expert participants. And the parameters that we were interested in eliciting were related to live weight, reproduction parameters, and lactation. So all those, it's important to note at this point that all those parameters I showed you that we need for the model, we don't need separate values for current and ideal for all of those parameters. Some of them will be the same in the current scenario and in the ideal. Other ones are fixed. So things like mortality, we reduce it to 0 in the ideal. So these are the main things we need. But these are also all stratified, so by species, age, sex, and in certain systems by production systems. So where we're asking for live weight, for an example, if we're looking at in cattle, we need a live weight for each age category and each sex. So there are a lot of parameters to be asked, even though it's a much smaller list than that original list. So our workshop structure started off with training in what we wanted from the ideal scenario and how to elicit probabilities. Our calibration questions, we used the current parameter values of the same target questions that we were interested in, so those parameters I just mentioned. And as I said, the target parameters were the ideal, those parameters under ideal conditions. We thought about uncertainty in terms of percentiles, so asked for 50th and 95th. And analysis was done using Excalibur software, and the judgments were combined using item weight performance measures. So the first output was a successful workshop. It was well received, and we were able to produce ideal parameter distributions from this workshop. These were then used to calculate the animal health envelope for cattle, small ruminants, and poultry in Ethiopia. And this has been a really important first step in using our program methodologies and in allowing our outputs, so the outputs of burden estimates, to be used by end users and stakeholders. So and for downstream analysis. So this has been a really important step in the evolution of GBADs. If you're interested, you can explore the outputs from this solicitation and the animal health envelope through our dashboards on our website. But we did identify challenges as a result of the elicitation process. And this is what I want to focus on a little bit today, and would be great to get your feedback on. So the first challenge we found that there was substantial overlap in at least some parameters between the current distribution and the ideal distribution that resulted. And this sometimes resulted in a kind of biologically implausible relationship between current and ideal parameter values. I'll talk about that in a little bit more detail in a moment. The second challenge was kind of high attrition of experts due to poor calibration scores. So when we were global here, but when we were weighting the experts, we ended up relying on a much smaller pool of experts than we had initially recruited. So to focus in on this first challenge, and this is the one that we spent most time focusing on and thinking about. So the difference between the ideal and the current scenarios. We would expect there to be some overlap. The idealized disease-free state, as I said, that it's still occurring in the same kind of genetic and environmental environment as the current, and there'll obviously be normal variation. Experts will have a spread of their predicted values. So some overlap is not at all unexpected, but we would expect that in general, the ideal parameter would be an improvement on the current value. That's making the assumption that disease is having an impact on the system. So we would expect to see a difference. And typically that means that the ideal value would be higher than the current, although that is obviously slightly dependent on the specific parameter that we're dealing with. However, what we found was that for some parameters, we had a really substantial overlap. So you can see in these top plots, there's quite substantial overlap between the two, the current in black and the ideal in red. These are the resulting distributions. And in some cases, this actually resulted in a kind of reverse of what we would expect. So the maximal values of the ideal scenario were actually worse than the maximal values of the current scenario, which obviously is not plausible biologically, and creates could potentially create some major issues for our analysis. So why was this occurring? It could be that the issue lies with our ideal scenario. So perhaps we hadn't chosen the right expert, perhaps we hadn't been able to identify the best expert. Maybe we haven't explained the ideal scenario effectively enough. It's that it's a deceptively simple theory, and that's actually quite complicated when we start getting into the nitty-gritty of it. It may be that we didn't provide sufficient contextual information, so experts weren't anchoring their current estimates to their ideal estimates to the current scenario. And it could also be as a result of expert fatigue. We were asking a lot of questions in quite an intense environment. Alternatively, we could also, the problem might also arise from our current scenario parameter estimates. As I said, these are data derived, but data in animal health, particularly in the global south, are not always accessible or of very high quality. So it could be that with certain parameters that are the data that we're using has overestimated the parameter, and that might be the source of the problem. So we're thinking about possible ways to tackle this. The first way would be to approach it purely from a modeling point of view, and we could mechanically constrain that relationship between ideal and current scenarios. But that's not really getting to the underlying problem of why this happened in the elicitation. So we've also been thinking about refining our elicitation technique. So in general, our general improvement, potential general improvements, thinking about improving our selection of experts and improving our explanation and discussion of the ideal scenario parameters. And that's something we are working on and we'll continue to do in each elicitation that goes forward. More specifically, thinking about how we structure the workshop. One idea that we had was to think about providing the current values of those parameters during the elicitation of the ideal parameters. So almost specifically anchoring the experts to the current values, either their own estimates or the true real world current values. Another option we are exploring is to add a discussion set in to allow the experts to revise their estimates, similar to a kind of idea protocol, a sort of modified idea protocol, I suppose would be. We could allow the experts to revise their estimates either in light of the current scenario values, again, either their own or data-derived estimates, or the group estimates of the ideal parameters. And we're also thinking about different approaches, so changing our approaches a bit more dramatically. So thinking about changing what we elicit. So instead of eliciting values themselves, we could think about eliciting a proportion change. So instead of saying what a milk yield would be and a value of that milk yield in under ideal health conditions, we could ask what we thought the percentage change would be if no disease was in that system. Or thinking about changing the approach completely, so thinking about how we changing our methods of listing, so thinking about visual animal scales, or even moving towards a kind of wisdom crowds approach rather than experts. So we're kind of considering all these options. Our second challenge, just briefly, was calibration, and we had quite a lot of low statistical accuracy scores amongst our experts, which led to a smaller pool of experts. Now we realised that this is quite common in elicitations, and it's not necessarily a problem in itself. But we're concerned that it may reflect that our calibration questions were not the most appropriate and therefore weren't reflecting the expert's accuracy. So, as I said, we used for our calibration questions, the current values of our target questions. But it may be that these weren't specific enough or that they were too difficult to answer. So an example would be the weights of animals, so looking at live weight. This was an issue for both calibration and target questions, that there's a lot of difference in weights between breeds and between systems. And our experts found it quite difficult to estimate an average when they were very focused on breed differences and so forth. So it may be that this is not the best question to have as a calibration question. So the next study that we have undertaken, is kind of going on at the moment, is our Senegalese case study looking at small ruminants. Now this is very much a work in process. The workshop led by Anne Mayer was undertaken, I think, last week or the week before in Senegal. So this is still very new data, and yeah, as I said, is kind of in process. But we undertook broadly the same process, the same methods to estimate those ideal scenario parameters. However, we put some adaptations in. So we focused a lot on really setting the context and a very in-depth explanation of that ideal scenario. We tried out different ways of explaining that to our experts. We also added in a discussion step to see if this would help with the issue that arose between ideal and current. So the experts were able to, after their first round of ideal estimation, they were able to review and discuss the round one estimates from the ideal, and then they were able to revise their estimates if they wanted to. As I said, this is all being analysed at the moment, so we don't have final results from this elicitation. But as you can see from these plots here, these just rough and ready plots here, actually this addition of this discussion round for some parameters actually led to the ideal scenario distributions that were worse than the first round of ideal. So at least initially, this doesn't seem to have been very successful in trying to solve the problem that we'd come across. This may change once we analyse, and this is all unweighted, so things could change still. But it's interesting to note that so far doesn't seem to have resolved our problem. Other challenges that we found with the workshop, this project has been undertaken under quite tight time constraints. So we only had limited options for how we changed the workshop. And found that explaining this complex hypothetical scenario was challenging, and making sure the experts really understood what we were asking was certainly a big difficulty and something we need to keep thinking about. The real world data to estimate our current scenarios was limited at the time of the workshop due to data sharing issues, and we were limited with availability of other facilitators for the workshop from local facilitators. Also, again, the same problem we had in Ethiopia. We're asking a lot of questions, so there, to a certain extent, will be a degree of expert expertise. So I hope that's given you a bit of a summary of the GBIRDS programme and the elicitation of the work that we've done so far, and some of the challenges we faced. Certainly for us, elicitation has been a really important tool that we've used to date in our Ethiopia and our Senegalese case studies. And it's enabled us to get these initial estimations that have enabled us to then go on and do downstream analysis towards burden estimation, which is really important. But our experience do reflect that we need to think about refining our methods and also reflect on the fundamental challenge of estimating this ideal health state. And so we need to think about the best ways to do that, and that's where I'm hoping people have some ideas here and will be willing to engage in discussion about this. We're working towards improving expert selection and our explanation of this ideal health state, which is a challenge. and exploring methodologies, changing our methodologies for the workshop. And again, Burned Rice, very welcome on that. In terms of things that we're doing immediately in the future, so we have another case study just about to start in Indonesia, and we're discussing and exploring our workshop protocols for that at the moment, thinking about maybe trying some of the other things that I spoke about. With the data that we already have, both from Ethiopia and Senegal, we need to, or we'd like to look at comparing kind of performance and equal weight decision makers to drill down a little bit into what's happening more with those calibration questions, and also sensitivity analysis to focus on which are the most important parameters. So finally, just to conclude, I just want to thank all my colleagues across the GBAD programme. We're a big international organisation, and I'm very fortunate to work with a huge variety of fantastic colleagues. Also to acknowledge GBAD funders and collaborators more broadly, and to encourage any questions and comments from you. Thank you.